Dok, ba't ganon? Tinatanong ko lang naman siya kung gusto ko sanang maintindihan yung kaso ko o yung sakit ko. Laging nagmamadali. Tapos, ang sungit. Ayaw natatanong. O kaya, ba't ganon, Dok? Tama ba yun? Tinanong ko siya, sabi ko, may bawal ba akong kainin dahil may cancer ako? Ang sagot niya, wala. Kainin mo lahat. May cancer ka na nga eh. Tama ba yun, Dok? Magandang araw po sa inyong lahat. Third video na natin ito. Welcome to my YouTube channel, Dr. LUNAS, Tumor, No More. On today's topic, ating i-discuss naman the kind of practice that I do, which is integrative medicine. But before I proceed onwards, lagi ko kasing nakakalimutan because I'm not a professional vlogger and I'm just starting out. So, gusto ko muna kayong imbitahan, yung mga pasyente. If you would like to have an integrative oncology medicine opinion on your cases, siyempre mga cancer cases, come and see me at my clinic. Ito, actually, this is my clinic. It's located at the Southpick Commercial Building at the heart of the city of Santa Rosa. Bagong-bagong clinic. We just opened up September 2nd of this year. Kumbaga, we prepared everything. We worked on this clinic for 3 months during the pandemic. And I am very proud na ito, ready na siya to serve you, dear cancer patients. So, for details, makita nyo siya I would place the details on the link below. And tsaka isa pa palang very important note ha. You can actually schedule an appointment kasi as part of anti-COVID strategy to protect not only you but actually to protect my staff, siyempre mga nurses ko and the rest of the team. Seeing me is strictly by appointment, and the consultation day sa Dr. LUNAS Cancer Clinic is on Wednesdays only, wherein you would have to communicate with us sa FB page na Dr. LUNAS para mag-set kayo ng appointment. Now, the appointment only serves as your reservation, meaning nakalista po kayo for that day. But it doesn't mean na pag dumating kayo, kailangan tignan agad kayo kasi ang dami po talagang patient. Ever since we opened up, I don't know if we can flash that footage na 4:30 pa lang po ng umaga, puno na yung parking dito ng mga pasyente ko. So, actually, nakalista sila, pero first come, first serve pa rin ang basis ng pagtingin ko sa inyo. And don't ever rush. Pag pumunta ka dito, it should be a dedicated time for you na pumunta sa akin para magpakonsulta. Hindi po yung nagmamadali kayo, sasabihin nyo, ang tagal, bakit ang tagal ng pag-aantay. Dapat po kung magpapakonsulta kayo, i-dedicate nyo yung araw na yon for consultation. Gaya ng nasabi ko sa inyo, iba dito dumarating 4:30, 5 o'clock. Ang clinic nag-open po siya 6 o'clock or 6:30. So, tagal din na naghihintay, pero okay lang. Minsan natitignan ko sila. 11 o'clock na, 10:30, kasi nga mahaba yung pila. And I spend really a considerable time with each patient. Kasi yun nga po ang pagkakaiba ng integrative medicine practice compared with purely Western. So, ganun ha. So, if you want to see me, again, I invite you to go to my FB page. Mag-communicate po kayo doon, set an appointment, and then punta kayo dito, magdala po kayo ng maraming pasensya kasi mahaba yung pila. Okay, so, to go on with our topic today, ang topic po natin is, i-define ko sa inyo siyempre, ano yung integrative medicine para maintindihan ninyo. Mind you ha, hindi ko po siya pinauso. I took notice of integrative medicine when I was in Singapore way back in 2005 nung nag-work po ako doon sa Johns Hopkins International Medical Center Cancer Medicine Division. So doon ko nakita sa Singapore po, hindi po purely Western medicine ang treatment nila sa cancer. Cancer patients undergo detoxification, may mga Eastern medicine stuff na ginagawa sa kanila. Ang aim kasi is holistic yung maging approach. Of course, syempre heavily relying pa rin naman sa Western medicine approach, pero laging may measures or may therapy for nutrition, detoxification, heavily used din ang TCM or traditional Chinese medicine such as acupuncture, acupressure, which I will be discussing in detail on this video. So, without further ado, ito na po. So, tatayo muna ako para mas maintindihan ninyo yung ating discussion with regards to this field of medicine. Whiteboard para mas maayos ninyong maintindihan. So, guys, integrative medicine. Nahati siya sa dalawa po. Ang definition kasi is, integrative medicine is the combination of Western and Eastern medicine. So, lagyan natin siya ng red bar dyan. Ayan. Yan po siya. Yan yung main classification ng dalawang component ng integrative medicine. I would discuss with you on this video from a perspective of a cancer doctor. So, cancer medicine lang. The application of integrative medicine sa cancer. Okay? So, Western medicine. Ano po ba yung Western medicine? This is medicine that is being practiced in the Philippines by all licensed physicians. Nakagaya ko. Lahat. Everyone you see. Basta hospitals, clinics, lahat po ng doktor dyan, technically practices Western medicine. Bakit Western? Kasi, though we have maybe hundreds or quite a number na of medical schools in the Philippines right now, lahat po ng authors ng books na pinag-aralan namin are mostly from the West. Even our health system is Western in orientation. So, yun ang Western medicine. And with Western medicine, as far as cancer, treating cancer is concerned, ito po yung ino-offer ng Western medicine na treatments for cancer. Number 1, surgery. So ako po, bilang Dr. LUNAS, Integrative Medicine Cancer Clinic, I never advise my patients na not to undergo surgery. Mali po yun. Big mistake yun. Kasi ang dictum po sa oncology is, any mass or any tumor, you should have it removed. Huwag mong alagaan, huwag mong titigan lang, huwag mong tapal-tapalan ng kung ano-ano lang, hoping na mawawala siya. Hindi ganon. Basta may bukol po, ipatanggal nyo. So, patients who really need surgery, I refer them for surgery. I have surgeons for friends. So, kailangan po talaga yan. Number 2, chemotherapy. Ito, this is a very important message for everyone. Dr. LUNAS Integrative Medicine Cancer Clinic, ako, I am not anti-chemo. I can show you cases wherein I refer them to those who do chemotherapy, mga medical oncologists na mga kaibigan ko. Nire-refer ko sila dahil kailangan yun. Example pong kaso, leukemia. I think there is a treatment for leukemia other than chemotherapy. So, I'm not anti-chemo. Hindi po gano'n. Nililinaw ko po sa inyo. May mga tumatawag kasi sa aking patients, iniisip nila na I would never go for chemotherapy. No. If it's needed, I would refer you to have one or to have a series of chemotherapy sessions. Third, radiotherapy. Ito po yung radiation oncology. This is my specialty. This is actually the residency training program that I underwent sa Jose Reyes. Okay, lalapit natin ng konti para mas maniwanag sa inyo. Alright. Okay, so sorry for that, ha? So, radiation therapy, the use of ionizing radiation to bombard tumors. Local treatment po siya kung saan itutok yung gantry, yung pinakaparang baril ng radiotherapy machine, doon mag-i-effect lang yung radiation. Unlike chemo po, generalized siya. Ang radiotherapy, sa mga radiotherapy centers yan, ano siya, localized form of cancer treatment. Very much like surgery. And next, hormone. Siyempre po, ang cancer kasi, may hormonal component siya. So, there are hormonal therapies existing for as far as Western medicine is concerned in treating cancer. And the very current or the latest in development in Western medicine, siyempre yung immunotherapy, wherein nagsasaksak na patients are given proteins, actually proteins yun, that act as immune cells to combat cancers generally din, meaning whole body. Okay, now we go to Eastern medicine po, sa Eastern medicine. These are some of the most common Eastern medicine modalities that are used for cancer or against cancer. Number one, if you have cancer, dapat po mag-detoxification ka. I truly adhere to this. Detoxification. Siyempre, in the form of organic food, siyempre, tapos siyempre, these are measures that I would discuss with you when you come to me. I-discuss ko sa inyo. So, detoxification, basically, linisin. Linisin yung katawan. Pag linis na po siya, nutritional therapy. Sipin yun, this makes so much sense, sabi nga. Linisin mo yung katawan and then infuse with the right nutrition. So, yung pong mga sumasagot sa tanong na, pag tinanong na, anong bawal sa nakainin, sasabihin, wala. Well, that's very unfortunate kasi meron po. Meron tamang pagkain sa mga cancer patients. Next, herbal medicine. Oh, ito po, herbal medicine. Alam na rin po natin yan kasi isa to sa reason kung bakit kinreate po yung tama law. Dito, tignan nyo po dito. Yan. This was created by the late Senator Juan Flavier, who himself is a physician like me. Kinreate po niya yan kasi recognizing the value of herbalism or herbal medicine when you use it for diseases. Massages, mga therapeutic massages, reflexology, lymphatic massages, lahat po yan in order to increase the circulation or to improve the circulation of the body. A very main part of Eastern therapy is TCM, traditional Chinese medicine. Andito yung mga acupuncture, alam niyo yan, needles, di ba? For WHO, ano na po yan. Sinertify na yan that acupuncture is very good for chemotherapy-induced nausea and vomiting. And cancer pain. Indicated na po ang acupuncture. Whereas before, maaaring tinatawanan yan. Pero hindi na po ngayon. WHO has already recognized that TCM has an application for cancer medicine. Next, Ayurveda. Ayurveda is the Indian medicine or the traditional Indian medicine. It uses herbalism, it uses oils, ganyan, and of course, a corresponding diet based on your personality. So when you go to an Ayurvedic doctor, you would be made to fill up a form and they would analyze your questions, yung answers niyo sa questions dun sa form, and they would be able to classify the kind of personality and the kind of herbs that is rightful or will help solve your problems with mga health problems ninyo. And it has been recognized din by the WHO already as legit, sabi nga. And of course, ito mapapansin nyo dito. Bakit naka-asterisk yung mind-body? Diba? Mind-body here is, ito yung, this is where we recognize the power of one's consciousness to effect healing or to manifest or to create healing on his body. Tandaan po natin ito, itong Western medicine and Eastern medicine, ang benefit po niyan ay teka lang sa body. But always remember, humans are not body lang. Hindi lang tayo body. We are made of spirit first. Ito na yung medyo ayaw naririnig ng mga purely Western practitioners, but this is the truth, guys. We are made of spirit, then mind. Oh, this mind, ito rin yung tinatawag na consciousness. Meaning, pag ang therapy na pinrovide po sa inyo is merong mind-body therapy, ito po yung mga tinatawag na meditation. Meditation, visualization, relaxation techniques, whether used for pain management or otherwise, then everything becomes truly holistic. So when the treatment that is provided to you is not just about your body, but also your spirit and your mind, yun po yung ang tawag na po ron is holistic. Ang approach is holistic. All these are what attracted me to this kind of discipline. At hindi po ito kung iniisip niyo na baka napauso ko lang ito, may papakita po ako sa inyong journal. Ito. Now, I want you to take note of the date. Ayan po. Tignan niyo yung date. So, matagal na po yan. Integrative oncology, or this science, this brand new form of medicine, has been existing for, I guess, 16 or 20 years. And it's heavily practiced po in European countries. And now, it's gaining ground din sa US. And I know, marami na rin naman akong mga colleagues, especially yung who believe in this discipline, they have already started out adopting this into their practice. Ako, I started doing heavy work on integrative medicine when I came home from Singapore. Yun, binago ko po yung practice ko. Hindi na ako purely Western. But I do not abhor Western. Ginagamit ko po yan. Kasi nga, though I am into integrative medicine, syempre, hindi natin pwedeng kalimutan ito. Kasi without this, it won't be holistic. So, mag-ingat po kayo kasi minsan, ang tendency naman ng mga nasa purely Eastern medicine practice is to badmouth yung Western. Ay, mali yun. Maling-mali po yun. Kasi diba, yung ibang makikita mo dito na who are actually practicing Eastern medicine or traditional medicine, sabi nga, ang tendency nila is to badmouth yung mga nagpa-practice ng Western. They even coach patient not to return to their attending doctors. Ngayon, pag malala na, na-experience ko to guys, na-experience ko to sa practice. When I was in Jose Reyes, I often see patients na malalaki na yung mga bukol, malala na sila, tapos pag tinanong ko sila, pumunta pala sila sa ganitong herbalist, sa ganitong blah blah blah. We're not nothing against them. But, unfortunately, yun nga, may mga ganong practitioners ng art ng Eastern medicine na they would talaga tell their patients not to go back to their Western doctors, Western medicine practicing doctors. Tapos pag malala na, sasabihin din nila, may bleeding, malalaking tumor na, hirap na huminga. Ang sasabihin nila sa patient is, punta ka sa emergency room. Ay, di ba, sino po bang tumatao sa emergency room? Di ba yun yung mga Western medicine practicing doctors? O di parang ano po yun, nung una, siniraan mo. Nung nagka-problema na yung treatment mo, binalik mo din doon. Diba? That's very unfair. Kung may isip lang ng mga patient, foul na foul yun. So, okay. So, balik tayo dito. Balik po ako sa celiac for a while. Alright. So, I hope with this video na intindihan nyo na po ngayon what integrative medicine is at bakit tinatry ko itong i-champion or, well, to my colleagues nung nasa purely Western medicine practice pa ako, I hope now you get a picture of why I shifted my practice into integrative medicine. And dun sa una kong the video before this, where I introduced myself, in-explain ko na doon my exposure, di ba, with my long exposure started in 2007 when I got home. Ito yun. Ipapakita ko sa inyo guys. Ito. When I came home from Singapore, ito agad yung inuna ko na. This is the proof that from the time I went home from Singapore, ito na. I shifted my practice to integrative medicine. And the rest is history, sabi ko nila. So, okay? So, thank you very much for listening. I hope na educate ko na kayo ngayon. And again, I'd like to invite you to subscribe. Siyempre, subscribe and like. Para naman umimprove yung audience ko, dumami, ano. And of course, ano po kayo, punta kayo sa FB page ko, sa FB page, to set appointments if you want to see me, again, and ito lang ha, lastly, importante po ito. I created this channel to serve as parang where I can offer this kind of medicine to cancer patients. But make no mistake, I never said or I never claimed that I am the best there is. No, hindi ganun. Hindi yun ang purpose po. Again, this is just one of the ways with which you try to address cancer. But at the end of the day, taking into consideration all this, tandaan niyo po ito. If you are a cancer patient, sir, ma'am, gagaling lang po kayo pag naniniwala po kayo sa doktor niyo. It actually does not matter what your doctor is doing, whether he or she believes only with Western medicine at galit siya sa Eastern, or he or she practices Eastern exclusively at sinisiraan naman niya yung Western, or doctors like me who integrate both. It doesn't matter. Hindi nagmamatter yun. The healing will only come because of you. The biggest factor po for a cancer patient to heal or to be cured of cancer or to beat cancer is his or her consciousness. If he or she believes that it's not a good day to die because of cancer and that he or she would beat it, madalas po ganun ang nangyayari. So what does this mean? It means kaming mga doktor po, whether purely Western ang practice or Eastern or both like me, kami po ay katulong nyo lang. Katulong nyo lang po kami sa healing journey ninyo. Ikayo pa rin po ang nagki-create or nagmamanifest ng healing ninyo. Alin sa inyo yon? Yung pong inyong the kind of heart or the kind of belief you have sa ginagawa sa inyong gamutan. So, I'm not saying I'm not doing this video to attract more patients. I cannot do that. I am just one of the many conscientious doctors, sabi nga, who's into cancer medicine. Of course, may mga mali din ang ginagawa, pero iwan na natin sila. Bahala na sila doon. So again, sa akin po, if you come to me, my approach towards cancer is ito siya. Integrative. Integrative po. Meaning, Western and Eastern together with mind-body medicine. Thank you so much. I'll see you on my next video. Salamat po. Bye-bye.